Hello, everybody. Welcome to another exciting episode of T times 4, Therapy Tea Time Talk. We're changing directions a little bit today. We're going to talk a little bit more about sports training in addition to coaching. When we think about sports, we think a little bit more about science. And when we think about training, we think a little bit more about coaching. And when we think about sports medicine, we think about injury prevention in addition to rehabilitation. Now, our next guest coming up onto our show today is the combination of all these aspects. He is a PhD in sports medicine. He's also a sports scientist and a trainer, in addition to a sports conditioning coach. Welcome to our show, Dr. Justin Lee.
Hi, Richie. How are you?
I'm doing good. Thank you very much for asking. Thank you for taking your time up to come up to our show today.
My great pleasure to join your show.
Thank you. All right, so let's start by talking a little bit more about your professions in this case. So what are your professions that you've done all the way from the past till now, and how long have you been doing it for? Take us through that story.
Yeah, okay. So I've started my sports coaching as a swimming coach like since 2000, so 20 years. So in my past 20 years, I do everything always related to sports, exercise, fitness. And then since 2008, then I start to do strength and conditioning. So first of all, I coach professional football team in Hong Kong. So it's about now 12 years. And since 2015, then because I finished my PhD, and then I start to do lecturing and research in the Chinese University of Hong Kong since 2015. So it's about like 6 years. I am kind of a teacher of the teacher.
And so in terms of the settings that you're based, so did you used to work a lot on field as well, and then change to doing a lot of teaching in clinic and also at the hospital in addition to classrooms? Can you take us a little bit more through that as well, please?
Yep. So it's always, for me, I mean, my career or my hobby is always about sports. So maybe half of them is practical. I'm a practitioner, I'm a coach, and other half is I work in a university, and which is based in a clinic. So we help injured athlete to get back to play. So it's more like an athletic trainer, sport trainer. And so we always try to do some assessment and also injury prevention screening tests to help the professional athletes. So I think it's like 50% on the field, 50% on the clinical setting.
And then when you're mentioning about the teaching in classrooms, can you tell us a little bit more about what you teach also in class as well in terms of the theory-based type of courses?
So my first degree is about the coaching science, sports science. So in the past 3 years, I always focus on exercise physiology, exercise prescription, and also the profession about the strength and conditioning. So these are the 3 main topics I always teach in the university.
So in terms of like your role on the sports field as an athletic trainer and sports trainer, can you give us a little bit more light in that area and like what you guys do on the field specifically? When you talk about, like, for example, injury prevention program, what are some of the examples of those programs that you guys develop and also do at your end?
Yeah, by the time I helped the professional soccer team, and I was a strength and conditioning coach, I was the lead strength and conditioning coach. But because we do not have a physio therapist who stay with the team every day on the pitch, so whenever they have injury or they might have some preparation for the game, for example, spot massage, spot taping, then I will take the role to do it. So these are I like almost do it like every day for this kind of work. And also in case they have injury, then we will work with different medical professionals, for example, doctors and physiotherapists. So doctor will make the diagnosis in Hong Kong, and then he will work with the physio, and I, as the strength and conditioning coach or athletic trainer, will try to work out the rehab plan and to execute it to make sure he will get back to play as soon as possible.
Could you tell us a little bit more about how you got started all the way from the beginning? Because it seems like you've transitioned through different areas and different profession relation to coaching, training, and also teaching as well. But take us all the way from the start and tell us a little bit more how you got started and what led you to start that all the way in the beginning.
Okay, so indeed my first degree is study biochemistry in Hong Kong, so which is not really related, but it is a very good science base for me. And then because I find out I really interested in sport, I have the passion in sport, so then I go to Australia, to Canberra, to study coaching science. So that is how I start. And so through that course, and then I realized when we need to be like a good coach, then we also need a very strong sports science background. And so this is, and also the Australian culture is very strong in sports, and they are so like a motivational, and this is how they inspire me to always have some, like for example, positive feedback to encourage the athlete to push the limit, but in a positive way. So that is really how I start my career in sports science.
And then how did you gradually transition into developing interest into doing sports medicine down the line?
Yep. So when I finished my first degree, then I need to choose to continue to study, for example, physiotherapist or postgraduate in sports science. And I am more interested to train athletes who are more healthy. So this is why I come back to Hong Kong and then do my further study. And I mean, to be a physiotherapist, that's definitely a very great job, but that is just, I want to train healthy people. So when I come back, then and I want to, to make the decision to study the PhD is really like a very, I really want to know more about the truth, and I really want to know how to have an efficient or effective way to train athletes. So this is why I do my further study. And because my university, my department is in orthopedics and traumatology, which people think is not really related to sport. I mean, when people get serious injury, they will see the doctor. And I was the only one to do injury prevention in the department. And somehow that is a research gap. That is a really good research gap. And by that time, back in 2012 or 2010, people were talking about exercise is medicine. And so that is really a great opportunity for me to develop injury prevention, especially in professional football setting.
Yeah, I absolutely believe that this is a very important aspect because, I think we should be looking into the prevention aspect in terms of the sports area, very, very significant. And I was also wondering about in terms of the sports science or sports scientist area specifically. So do you do a lot of like exercise physiology type of testing for your athletes before as well?
Yeah, definitely. For me, I think testing is the very important element for training elite athlete, because number one, you want to know the baseline. Number two, you want to know if your training works. So regularly baseline test is very good. So for example, when I train Kichi, the professional football team in Hong Kong, we helped them for 6 years. We get several champions. And we do regular tests 3 times a year. The first one will be in the pre-season, and apart from the fitness testing, we also do lab tests, for example, VO2 max tests. So we know exactly who is better, who need more training throughout the season. And also we do musculoskeletal screening tests by the doctor and physiotherapist. And then, of course, I need to help them. So to make sure all of them are healthy enough to participate the following season. and also because we are a research lab, so every year we have some kind of injury prevention screening test. For example, for my profession is the Nordic hamstring strength test. I think the eccentric hamstring strength is a big topic in both professional football setting and also in the research injury prevention research field. So we try to find out those athletes with high risk to injure the hamstring. So so we do regular tests. We also do some tests for the research project as well.
And how do you think your program designs and coaching and basically changed over these years with now that you've been in different areas and have developed even more expertise in different areas?
Well, I think number one, my philosophy is we always try to improve every day by knowing more what is happening in the research world and also knowing what top athlete is training, and then you try to modify the way we practice. So now in the past 3 years, I work in a commercial setting. Then I get to know more commercial strength and conditioning coach and personal trainer. Then we'll discuss more how we can get the best practice. And of course, I am the guest lecturer and also the part-time lecturer in the university. Then I will try to discuss with different scientists, so to know more in new training method. And by this way, then we try with myself. So I do not have a lot of clients. I have a few, maybe 50, 60 years old senior clients and also a few athletes. But this is the way I keep practice and keep learning myself every year and try to take some new certification course. So this is how I improve or have my new training method every year.
In terms of your training or your sessions overall with your clients, I'm referring to, let's say, I'm understanding that you actually do both, right? The one-on-one aspect and also one-to-a-group aspect. What is the length of or the duration of a session like normally?
Yeah, for example, if you train professional athlete, and normally in Hong Kong we do not have a lot of resources, then it's like 1 or 2 coaches will train like 30 athletes. Then it will be like a 1 hour and a half or 2 hour section. And because their physical fitness is different, right? I mean, he's stronger and faster, so he can train longer. So normally we'll set, depends on resources. So I need to manage myself need to manage 20 of them. For example, I set different stations, they need to rotate. So it will take about like 90 minutes of the training. And for one-to-one, normally, if we can manage the time well, so I think 45 minutes to 1 hour will be good enough. And because you will pay more attention to the athlete and or the client, then definitely that is a very intensive 45 and 1 hour section.
And what is the approximate ratio of the split session like? Like how much of it is actually like a warm-up, or for example, how long would it be when it comes to the actual training high intensity session? Like what is the approximate split ratio like?
Well, for example, professional football. So let's say training is about 1 hour and 30 minutes. So let's say 90 minutes. Then the first 30 minutes or 20 minutes will be like warm up. But when we talk about warm up for this kind of top athlete, so it will be like 5-10 minutes general dynamic warm up, very general, and then we'll start to use some ball and then do some like strength and conditioning part, but it's more without the ball. So for me it's like prepare the body for like the main section, which is with the ball. And so when we talk about this is warm up, for us it's like a strength training. or like a high intensity training. For them, it's like it's hard, but it's like warm up. And then another 45 minutes, and then we try to split the 45 minutes to 2 to 3 sections with some progression, and try to, if I train that day is like a tough day, then for example, we use small side game to train the cardiovascular fitness or repeated sprint ability. So then we try to use 2-3 section and with some progression and some training theme. And at the end of the session, every day we try to especially with tough training, we'll also put ice bath and some cool down section and some stretches. We do it every day. So normally this is how I split the daily program.
In terms of the program duration, in that case, the protocols that you talked about, or the methodologies that you talked about, like post-exercise, such as icing and those other areas, it has to be done quite on a consistent basis for it to have good effects. Is that correct?
Yeah, and we also need like a periodization, because of course, as coaches, or especially football coaches, they want to train very hard every day for every day, but indeed is the players will get injured, overtrain. So this is why we need to plan for some pre-season at the very beginning when they are not super fit, because after the off season, then we will train hard, but we'll like have some weekly periodization. We can't train every day hard. And also during the season, for example, in the gym, we can't train really hard because every day they have training, and also every weekend they have an important game. So this is how we manipulate the training intensity and the volume, try to minimize the injury risk and also maximize the performance.
And in terms of the training aspect overall, then in that case, let's say when they finish the games or when they finish the training, do they sometimes get homework that they can do by themselves as well? Or is that something that you prescribe to them too?
Yeah, so for homework, normally they will not do it at home because obviously they have very strong training every day. When they're at home, they'll really rest. But we do give them like recovery protocol. For example, we'll give them a program that they can do in a swimming pool that is for recovery section, and so they can go by themselves. So because they are professional athlete, they will really look after themselves. So this is so they will really do the homework if they're professional. And also we'll give them some like rehabilitation exercise, because we have limited training time every day. So but they are all individual. So for example, some have recurrent ankle sprain, so make sure they will have come to the pitch like 15 minutes earlier, so they can really do some homework before. So day by day, then they will like really can prevent the recurrent ankle sprain in that case. So so this is the homeworks, but they will not do it at home.
I understand. So it's more like a recovery type of protocol that they have to be continuing on a continuing basis under some level of supervision. Is that correct?
Yeah, definitely.
Okay, so my next question for you now is would there be any specific advices that you would give people that are new to this field or wanting to get into this field?
Number one, I think it's very important that do you really have the passion in this field. Otherwise, in Hong Kong, we always say, oh, you work in sports industry, so you will not have like big money, okay? So I think yes or no. Yeah, it really depends. If you work really well, people are willing to pay you. If you just want to stay there and just try to earn money, people will not give you a big money because you can't help them. So number one is passion. And number two, I think we as a coach, practitioner, we need to keep learning because the world is changing. Yesterday we talked about stretching can prevent injury. And today we're talking about static stretching might not helping too much. Then what is next? So that's why if you have the undergraduate degree, and I will encourage you to study, like further study, doesn't have to be PhD, but a research degree definitely will help you to improve your critical thinking skill, and also the way how you can find good literature that can help your practice. So even you do not have the first degree, you can think about to have some sports science first degree, or a different kind of certification, which is give you that strong background. And also we always need to look for new trend or training methodology. For example, these days we talk about mobility. Why we talk about mobility? Because people train hard, people want to be a champion, but they get injured, and then people start to think about why. So mobility is not really like a gimmick. I think it's about something that we need to pick up. Maybe it's our weak point. So for a very famous trainer in the United States, they talk about weak point training. So I think for athlete, for human being, we need to think about our weak point, and we need to improve our weak point.
And now, if you could go back in time and give yourself one piece of advice, what would you give yourself?
So it might get you confused, but if I go back, I might try to be more focused. But if I try to be more focused, then I will not have a mixed background like myself now. So so because now I think the only problem I have is the time management. I think we all do, right? I try to do a management role in a commercial gym, and then a teacher, and then also practitioner. So should I try to be focused? So that might be the question I should ask myself back in like 20 years ago.
Thank you for sharing that. That was a really good way of describing it. I think I understand when you said about confusion, right? Because you mentioned that when you do go back, if you don't do that, you wouldn't have had the diverse background that you're having right now, though. But I guess, after all, I think you have shared with us a lot about the importance of getting continuing education, and also understanding what you want in terms of passion as well. That's going to down the line be able to help you build your career, right? Is that correct?
Yeah, exactly.
So thank you very much. I think that's all the time we have on the show today. And I'd like to thank Dr. Justin Lee for coming up to our show again. And we can all definitely learn a lot from his story today, and his sharing as well in terms of his area and different levels of professions. So again, this is Therapy Tea Time Talk, T times 4. Have a nice day.
Have a nice day.